Ramesh Adalja, the senior scholar at the Johns Hopkins Center for Health Security. Doctor, thank you for joining me. As Maggie just mentioned, a federal health official said that there are no plans for a mandatory quarantine of those passengers once they arrive in Nebraska. What do you make of that?
That's exactly how I would do it. I don't necessarily think that you have to have a mandatory quarantine because, first of all, not all of those 17 Americans have the same level of exposure. None of them are symptomatic. This is a disease with a very limited transmissibility, and the transmissibility occurs when you have symptoms. So there are alternative ways to do this that are less restrictive, which is home monitoring, engagement with local public health. And this isn't unprecedented. Remember, in 2014, we had a major outbreak of Ebola in West Africa. Many healthcare workers from the United States were monitored in the same manner for a higher consequence disease where the stakes were even higher, and that went off very well. So I think this is a reasonable approach.
All right, and doctor, several states, they're already monitoring U.S. residents who've already gotten off the cruise ship. What does that monitoring actually look like?
So it's going to vary from state to state, but in general, it's going to be checking in with local health authorities. It's going to be measuring your temperature at regular intervals. It might be keeping a journal of symptoms that you might be having. And this will go on for about 6 weeks. And if you develop any symptoms that are consistent with hantavirus, that you get rapidly tested and linked to care.
Now, the hantavirus, it's not a new pathogen, but have we seen an outbreak of it on this scale before?
Well, it depends on how you define the scale. So there's 8 people that have been infected with hantavirus. The biggest hantavirus outbreak on record is 34 with the Andes version. So this is smaller, but obviously there are logistical challenges that are different because you've got 150 passengers from different countries and all of that contact tracing that needs to occur. That, in a sense, is kind of unprecedented, but we've seen bigger outbreaks of hantavirus in the past.
All right, Dr. Ramesh Adalja, thank you so much for that. Now to a boat explosion right off the coast.